You are most welcome to this update, and it's Christmas Eve, so happy Christmas Eve indeed. Pity the virus doesn't take Christmas off. Unfortunately, that'll still be working full time. Bit of good news to start off with on vaccines today. Some very encouraging signs there. But I'm not going to hide my concern about this new variant that's coming from South Africa and the variant that has arisen in the UK. So some talk of those and a little bit about what that means, and some evidence starting to come in, some firmer evidence starting to come in on the increased transmissibility of this variant that was first identified in Kent. So let's get down to that now. So Canada, this is the good news here, Canada approves the Moderna National Institutes of Health vaccine developed in the United States. So great news. It's got 40 million doses on order, and it's got the Pfizer vaccine already rolling out. So between these two, Canada's probably got just about enough vaccines to vaccinate its entire population. So the way Canada is going, with its good logistics and relatively small population size, I expect Canada to be the first country in the world to reach herd immunity as a result of vaccination. They are actually leading the way in this. So good news for Canada. France, also good news. It's approved the Pfizer BioNTec vaccine, all those aged over 16. Distribution starts on Sunday, a few days time. First jab should be on Monday, the 28th of December. Now, this is remarkably delayed overall, of course, because the European Medicines Agency had to authorise this first for the whole European Union before the individual 27 member states could authorise it themselves. And the fact that the French authorities have done this in a few days means they had all that data already. They'd done all the homework, they'd crunched it already. They knew this was coming and they were ready to roll, and they've done it in a few days. Pity about the few weeks delay. And if it hadn't been for pressure from Spain and Germany, the European Medicines Agency hadn't even planned to meet till the 29th of December, whereas France will actually be injecting people on the 28th of December. So difficult to explain the great lack of urgency that the European Medicines Agency has been displaying, but hope that they seem to have got their act together, at least on the Pfizer now. Let's hope they act more quickly on the Moderna, and let's hope they act more quickly on the Oxford AstraZeneca vaccine as well, because they've got 300 million doses of that booked. Let's hope they act much quicker than they have done. Right, United Kingdom, between the 18th and 20th, we've bashed out over 500,000 injections, so that's good. Over 80s, I've had 366,000 of those, 70% of those are over 80s, and of course these are the group most likely to die. And healthcare staff have had roughly the other 30%. Now, well, I've got to tell you now, I've started. I have had an email saying that one batch was lost on this because of the temperature rising above the -70. Now, whether that's true or not, I can't confirm it. It hasn't been officially released by the health service. If it has, someone really needs to get their act together, because we can't afford to waste any vaccine. But it does show the logistical difficulties with the Pfizer. The Moderna is quite a bit easier because it's normal freezer temperatures, and the Oxford is going to be even easier still because it's at normal fridge temperatures, which we have no bother maintaining at all. Now, the United States, I've just listened to a popular news report, and it said there's 115 million people travelling for Christmas and New Year in the United States. 115 million people travelling. Can this be true? Can an intelligent, sophisticated nation like the United States embark on this suicidal path? It appears so. 150 million people are travelling. So let me tell you what this means. It means the infection is spreading rampantly. It means we're going to get a massive increase in diagnosed cases in the next week or two. It means that cases are going to absolutely surge in January, the beginning and the middle of January. First 3 weeks in January, cases are going to absolutely surge. And that means hospitalisations and deaths will surge towards the end of January. This is just like night follows day. This will happen. It's just inexplicable that 115 million have travelled. And while the vast majority of people in the States are behaving really well, I've seen pictures just on popular news outlets about airports in the United States. Millions of people travelling around the States, and many actually not wearing masks. It beggars credulity, and the effects will be, as I've just described. This is an absolute tragedy that's going to be unfolding in the United States in January and February. It will inevitably happen. And it's just, quite honest, as an outsider, it's difficult to watch. Anyway, that is what 150 million people have decided to do, exercising their constitutional freedoms. Now, this South Africa variant. There's been Christmas parties in South Africa with a lot of alcohol involved in many places, and these have acted as super spreader events. So this has given the virus really quite a nice kick start. In fact, the virus couldn't have hoped for much better, really. It's been ideal. Combination of social mixing, confined spaces and alcohol. It suits it down to the ground, so that's perfect for the virus. Now, the South Africa variant is called 501v2. That is the name of the variant. And it's the 501, the 501st amino acid, as we've discussed several times, where the N amino acid is changed to the Y amino acid. Now, this is the same mutation, exactly the same mutation that has arisen in the UK, in the one that was identified in the UK, the 2012. It's a completely different evolutionary origin. The two mutations have arisen completely separately. But because they've both been selected for, means that this is a highly advantageous mutation for the virus. So when the 501 changes from the N to the Y, the virus survives a lot better, reproduces better, therefore that is selected for. And it's been evolutionary selected for in South Africa and in the UK and who knows where else, as we're going to check on in a minute. So that is happening. Now, there's been 2 cases of this South African variant. We're talking about the South Africa variant that have arrived in the UK that have been detected. So they're in London at the moment, in London and the northwest of England. So there's one in London, one in the northwest of England. Diagnosed 2 days ago on Tuesday. Travel restrictions are now imposed. A flight landed from Johannesburg, I checked on the schedules, from Johannesburg to London Heathrow at 7:07:19 Thursday morning, this morning. It landed already. Now, they have put in travel restrictions. Today's flight is banned, but there's been a flight from South Africa every day for months. People are still travelling around in this pandemic as if there is no pandemic. It's, you know, I'm just not computing here. Why don't people realise there's a pandemic? I've got a right to fly from South Africa to England. A few people might die, but hey ho, I've got a right. Anyway, Johannesburg to London Heathrow landed this morning. Today's flight's banned. Horses and stable doors come to mind. But if you'd like to, if you're in South Africa and you fancy it, if you've got a few whatever they spend in South Africa, rand or whatever it is to spare, then you can go to Singapore today if you'd like, or do you fancy Doha? Or maybe you fancy China, or Amsterdam, or Paris. Choose one, because the flights are there, the flights are going. There's a new deadly mutation. The flights are still flying. And many people bounce onto the States because people flying to the States, of course, tend to bounce off via Europe. And of course, Singapore and Doha, I don't know, but I would say 50% or more of the people that fly into Singapore or Doha, they're simply using it as a hub to bounce on somewhere else. Let me put that another way. This mutation is in the process of spreading around the world as we speak, with the speed of a jet airplane. Now, I'll come to that in a minute. This is the South African Minister of Health Twitter feed. Anyone from South Africa so this is the British advice. Anyone from South Africa must quarantine immediately, and their whole household must quarantine. So if someone has arrived back from South Africa, the whole household must quarantine for 14 days. I'm saying 14 days. I think the government's saying 10 days, but I would like it a bit more. Now, that Twitter feed I showed you there is from this chap, Dr. Mkhize. Sorry, sir, if I pronounced your name wrong. Anyway, he's a medical doctor and is the South African Minister of Health, has been since 2019, I think. Now, he says South Africa sequenced hundreds of genomes since the start of this pandemic, as if that's a good thing. Well, it is a good thing, but in the UK we've sequenced 140,000. So a few hundred for a country the size of South Africa is nothing. It's absolutely minimal sequencing. Nothing to boast about at all, Doctor, I'm afraid. I mean, it's really not good coverage at all. Now, he is saying young previously healthy people are now becoming sick. This is a direct quote. And he's comparing what they are potentially going through now with the HIV pandemic. Cannot go through what we went through in the early years of the AIDS pandemic now. These statements are alarming. There's no two ways about it. This is a Minister of Health, a medical man, who is saying that young healthy people are getting more disease. And he's comparing it with the absolute disaster of the AIDS pandemic. I hope his comparison is unwise and ill-judged, but we simply don't know. Now, of course, we have no peer-reviewed information on this at the moment, but what we have, these are his Twitter feeds. Now, I don't like news by Twitter feed, but it's what we've got. So there he talks about the hundreds of things there. Now, here he says, clinicians have been providing anecdotal evidence of a shift in the clinical epidemiological picture, in particularly noting that they are seeing a larger proportion of younger patients with no comorbidities presenting with critical illness. The evidence has been collated, therefore strongly suggests that the current second wave we are experiencing is being driven by the new variant. So the great increases that we've seen in South Africa, I'll show you a slide of that later. We're seeing great increases in the cases in South Africa. He's saying that they are driven by the new variant. And he's also saying that this new variant is making younger people without comorbidities sick at a higher proportion compared to the old variant. Now, this is just him collecting information around the country. But he is the Minister of Health, he is a doctor, and we can assume he's well informed by all the other doctors in South Africa. What we are seeing now is the rate of increase in cases similar as the first wave, but the second wave has now overshot the peak of the first wave, so it's bigger. The second wave has now hit all provinces with some early signs it is spreading faster than the first wave. And it goes on, the link is there. This new 501.V2 variant has become the dominant in South Africa. This new variant has 3 mutations, so it's not just the 501, there's other mutations associated with that. The higher viral load in swabs may translate into a higher efficiency of transmission. So it is seeming that people are having higher viral loads. That can make them sicker and it will make them more infectious. We are seeing such a high proportion of the new variant than the rest of the world. So they're seeing a much higher. So it looks like it may well have arisen in South Africa. Now, having been somewhat critical of the level of sequencing in South Africa, it's better than Nigeria that we looked at yesterday, which apparently is doing no sequencing. So it could well be that this variant is all over in many parts of Africa, but they've just picked it up in South Africa because in South Africa at least they are doing some sequencing. Now, what are the views of other experts? Professor Neil Ferguson, Imperial College, well-known modeller, of course. I think the greatest concern of ours at the moment is the new South African one. So he's talking about the South African variant compared to the 2012 variant that was first picked up in Kent. Let's call that the Kent variant for now, because that's where it's first picked up. So he's more concerned about the South African one. There's certainly anecdotal reports of explosive outbreaks for that virus and the very steep increases in case numbers. So pretty strong language, really. Mr. Hancock, Minister of Health in the UK, of course, new variant is highly concerning. That's a direct quote. So the Minister of Health in the UK is highly concerned about the South Africa variant. Anyone told to quarantine must avoid all contact with other persons whatsoever. It must be an absolute quarantine. And I do hope for South Africa, people from South Africa, this is being policed. Not necessarily by the police, of course, but by contact tracers and people that are keeping an eye on this, as they did in Australia. Professor Lawrence Young, Warwick Medical School, the move to harsher levels of restrictions across the country is inevitable. So this is mostly talking about the UK variant now. But still talking about the South Africa variant here. Alan Windy, Western Cape Premier. Hospitals in the province under severe strain. And the hospitals in Western Cape, of course, are better equipped and organised than the ones in Eastern Cape. More COVID-19 cases than during the first wave. So severe strain in the better parts of South Africa. And the hospitals are being cleared of other patients so that more COVID patients can be accommodated. We do this from time to time in hospitals. I've been involved in this a few times. We call it having a good chuck out. Any patient who can be discharged safely is discharged to leave space for a major incident. Now, talking about the mutation now in the UK, the 2012 mutation. So back to the UK mutation now. Again, affecting the same amino acid. And there's been a paper published. Estimated transmissibility and severity of novel SARS coronavirus 2 variant of concern, and that's the one we're talking about. This is the Kent mutation. Apologies to the people in Kent, but we'll call it that for now. But it's the 2012/01 mutation. I think they're calling it something different in the States, but we'll go with this for now. Now, this paper was published by the Centre for Mathematical Modelling of Infectious Diseases, London School of Hygiene and Tropical Medicine. So these are serious epidemiological scientists. Of course, it's vital to stress there has been no time at all to peer review this paper, so it is not peer reviewed. But it's been internally reviewed by the institution. Appears to be rapidly spreading towards fixation. In other words, this 2012 variant is becoming the pandemic in the UK. It's becoming the main variant in the UK. This is the name of it here, VOC 2020-1201. It's 56% more transmissible according to their figures. So that is the latest increase in transmissibility compared to the old variant, 56%. And they're 95% sure the increase in transmissibility is between 50 and 74%. Now, we had been talking 70-71%. This is slightly less. But make no mistake, this is enough to radically change the whole face and course of the pandemic for the worse. They say there's no clear evidence of greater or lesser severity of disease. So different from the intimations from South Africa. Increase in transmissibility, is going to cause a large increase in incidence. There's going to be a lot more cases. There's going to be a rapid increase of cases in the UK according to this modelling. COVID-19 hospitalisations and death projections to reach higher levels in 2021 than we observed in 2020. So there's going to be accelerated growth in January and February according to this modelling. Even if the regional tier restrictions implemented before 19th of December are maintained. In other words, the tier restrictions that were having an effect, they're not going to be good enough to contain the more transmissible form of this virus, which is becoming the dominant form, unless primary schools, secondary schools and universities are also closed. So it looks like, according to this model, we're going to have a choice. We can close all this lot down, or we can have a massive surge in cases. Take your pick. It looks like that is the case. And we have noticed that there's been an increasing prevalence in school-aged children of late as well. Large resurgences of the viruses are likely to occur following easing of control measures, if they are eased. But as I say, the ones that we've got now are no longer stringent enough in many cases for this more transmissible virus. This is a direct quote. Greatly accelerate vaccine rollout to have an appreciable impact in the suppression of the resulting disease burden. They're saying we need to get this vaccine out much quicker than we are. To that end, the UK will be approving the Oxford vaccine in a few days' time, I am sure. Now, in the UK, China has banned flights from the UK in this act of supreme irony. So China bans flights from the UK, and we advocated banning flights from China on this channel in February. It didn't happen, and as a result we have this unnecessary pandemic. I'm trying to say this deliberately calmly now because I can just feel the emotion rising in me, I'm afraid. What an irony this is. Dear me, if only we didn't have this unnecessary pandemic. But China doesn't want it back, so I'd have to say that rightly China have banned flights from the UK now, but as of today you can get a flight from South Africa to China. So go figure. Doesn't make sense, does it? Cases are already increasing in the UK. Quite a dramatic increase. We'll just look at the Zoe tracker app a minute here. So this is good. It gives a bit of a regional breakdown for the UK. This is the number of new cases from the symptomatic cases. The real number of cases is always a bit higher, and it shows the areas where the new variant of the virus are worst affected. And we see the total number of people there as of the 24th of December, 435,718 currently showing symptoms in the UK. Therefore we can add about 20% onto that for the real number in the UK. So it's daily record number at the moment. In London, the prevalence of SARS coronavirus 2 infection as we speak is 2%. So 2% of the population of London are infected right now, and it's mostly the new variant. Now, I'm aware we're going on a bit long today, but there's some really important stuff here, I think. Let's look at the percentage of this is the percentage of positive tests with the new strain. So in London we see that it's about 65%. So in other words, all of these cases in London, 65% of all these cases in London are the new strain, over 60%. Over 60% in the southeast of England and the east of England as well. And we're on about what, just under 50% in Northern Ireland and England as a whole. Less of the new variant as we look at the other areas of the UK. But this new variant is going to take over. It is going to become the most prevalent variant. So all of these figures for all of these areas are progressively going to carry on increasing, unfortunately. Deaths at the moment in the UK have increased by 744 in the last 24 hours. That's the number of deaths within 28 days of a diagnosis. That's the number of deaths according to the Office for National Statistics. And we can correlate the increase in cases with the emergence of this new variant. So where new variant is lower, Midlands, Northern Ireland, North and Scotland, cases are lower. South, East and London, where the new variant is more prevalent, and Wales, where the new variant is more prevalent. Actually, it's not quite as new. Wales is not such a big factor, is it? So maybe it's underdiagnosed in Wales. But anyway, whatever the cause, Wales has a great increase in cases. I suspect more of this will be due to the new variant as more genomic testing is done. But we know in the southeastern London, it's well correlated with the new variant. I'm just going to give you a few more brief facts. So regions, basically, we are going to increase the number of people in Tier 4, another 6 million people, mostly in areas contiguous with the southeast zones. That happens on Boxing Day, day after tomorrow. New lockdown starting throughout the country. Old tier system was not enough to contain the new variant. Cases in the UK have risen by 57% in the past 7 days. This is just a massive escalation. Hospital admissions are highest since mid-April. The new variant is spreading. And just to confirm that with some official data, so we're not making anything up, this is the latest Office for National Statistics published today, 12th to the 18th of December. England, the prevalence is increasing. It's 1 in 85 people in England now, although as we saw, 1 in 50 in London. Wales, it's 1 in 60. Very high prevalence in Wales. Northern Ireland less, Scotland less, but Scotland has much less of the new variant. Now, we're done nearly. Just the BBC's done something useful, which I'm pleased about. Hands, face, space, ventilate. We have been going on this channel about the importance of ventilation for months, and I'm glad the BBC has at last picked it up, albeit not until the 24th of December. So the new saying can be hands, face, space, replace. Replace meaning, of course, replace the air. Now, the cases are going up in Russia. Russia massively underdiagnoses and massively under-records deaths, and yet they're showing these increases. So what I'm just wondering is to what degree the new variant is having an effect in Russia. Okay, was I going to show you some pictures today? Don't seem to have them. Okay, we'll leave it there for today. So and I haven't brought my phone either. I was going to show you the books, but basically, you've seen this before, but you can download my textbooks free. And I'm going to post the link again. And the reason I forgot my mobile phone was you can download it onto your mobile phone. So if you go into the I'm showing you those on the wrong camera, wasn't I? Sorry. Hope you can see them. Right. So they're the books for free download. The reason we're doing it free is so people in poorer areas can have free textbooks. Now, if you load YouTube on your mobile phone and click on the link, then you can download those directly and read them with a PDF reader on your phone, which is what I was going to tell you. No, can't show any pictures today. I forgot to put them on. Silly me. Never mind. Okay. So, well, it's going to be a difficult January, February, isn't it? There's no two ways about that. I'm sorry. Not ideal news before Christmas, but that is the facts of the matter. And in the next few days, we'll be finding about if and how much these new mutations have spread in the United States. And that combined with 115 million people travelling is not going to be good for January, February. Sorry about that note, but on that note, which does reflect the nature of reality, unfortunately, have a great day tomorrow. Have a great day, and thank you for watching these videos, of course, as always.